Sawadee. So good afternoon. Welcome back to Health Talk, Health Dialogue by BDMS. Today we are here with a special topic, mosquito-borne infection in Phuket. And let's meet our speaker, Dr. Benjawan Skulsujirapa, the Infectious Disease Bangkok Hospital, Phuket. Sawadee.
Okay, thank you for your kind introduction and thank you for having me here today. The topic we will talk about today is the mosquito-borne infection in Phuket area.
I think it's really suited for this island because we have a lot of mosquito and we really have to worry about this and have to know more information about the diseases that may caused by the mosquitoes.
So the reason we're talking about this today is because during the past 1-2 months, there has been an increasing number of cases who presented with fever, pain in muscles, pain in joints, and a rash who later turned out to be one of the 3 diseases we will talk about today, which are dengue virus, Zika virus, and Chikungunya virus.
So there are 3 different diseases that may happen because of mosquito bite.
Yes, actually there are some more diseases like malaria, West Nile virus, but the 3 that we will talk about today is the 3 viruses that is there is an outbreak right now in this area.
In this area, you mean Phuket Island or
in Phuket
which area?
In Phuket Island.
Oh, are we lucky? But I'm sure we are lucky that we have chance to listen to Dr. Benjawan today, that we can protect ourselves and take care of our family members and our loved ones.
Yes.
Okay.
Next slide, please.
Okay.
So these are the 3 viruses that we will talk about today. The first one, dengue virus, which you might have known already because Thailand is endemic country, and this virus is quite well known both in Thai people and in foreigners. And the second one is the Zika virus. The third one is the Chikungunya virus. Next slide, please. So as I said, Thailand is an endemic area for dengue virus, but for Chikungunya virus and Zika virus, it depends on the area that you live in. So Thailand overall, in general, is considered a country at risk for these 2 viruses, but especially in Phuket area, we had reports of an outbreak of Zika virus since last month, and until now we've seen an increasing number of cases still.
Here, most of us listen or hear only about COVID-19. So during the period of time, you mean last month, is already outbreak on Phuket Island.
Yes, and it may have been around long, even before that, but because some people presented with mild symptoms, they didn't actually come and get tested for the virus. But we've heard that there were some cases of fever with rash in the area, like in the neighborhood of patients who were later confirmed as having Zika virus.
Okay, that means if we feel like we got bitten by mosquitoes and we have rash and fever, not only rash may be just allergic a little bit, but if you have fever, you have to go to see the doctor.
You should, especially I would say the most concern is for pregnant women because some of the diseases that we will talk about today has complications, which are really important in pregnant women.
Okay, so we focus more on pregnancy women.
Yes, that's right.
Yeah, it may cause kind of more effect on the pregnancy.
Yes, for Zika virus.
I think we need to know more information about that.
Can we go on to the next slide, please?
Yeah, and the next slide. Is this already on the 3rd one?
Okay, so I would say what the important complications of each of the virus is different. Like for dengue virus, the most important thing is shock bleeding, and which could result in some cases, which could lead to death in some cases.
Oh.
For Zika virus and for Chikungunya virus, it's quite rare to, the risk of death is quite rare, but for Zika virus, the complications that we are most concerned about is anomalies in fetus. So it could happen in pregnant women, even if you don't have symptoms.
Oh, so you just mentioned dengue fever and may cause to death.
Yes, it could result in death.
Oh.
So like among these three viruses, the most dangerous one I would say is dengue fever. And also it's, I would say we have a lot more cases of dengue fever around than Zika and Chikungunya.
Okay, but how can I know that when should I come into the hospital? What kind of condition or symptom that I'm having, and then I should come to see the doctor?
The difference between these group of viruses to COVID-19 or to common cold is these viruses get into the body via mosquito bite. So normally you won't have any respiratory symptoms. You won't have cough, sore throat, or runny nose. If you have fever with or without rash, muscle pain, headache, without any respiratory symptoms, I would recommend that you get tested.
You mean fever and muscle pain in one day or longer? Should we observe a little bit longer?
It depends on how severe symptoms you have. If you have mild fever without any other symptoms, you can eat well without being dehydrated or something like that. You can observe like 1 or 2 days.
Is it more serious on the old age or someone who has like chronic disease?
Yes, of course. Like most infections, not only with these viruses, most infections tend to have more consequences, complications in people with chronic underlying diseases, like heart disease, diabetes, lung problems, something like that.
And old age.
And old age as well.
So I say that, but I don't know which age it starts and concerned with the old age.
I would say it's difficult to say it, but we usually say over 60. But some people who are already over 60, they live a very healthy life and
they may look 50
really
or
good,
40.
in a really good shape. So I would say it's difficult to say.
Okay. So we observe ourselves and we take care of our family member and observe if fever, muscle pain, with or without rash, maybe need to go to see the doctor and get the test.
Yes.
Okay. So how long after we got the test, how long we have to wait until we get the result?
For dengue virus, there are several tests available. Usually we do the screening test first. If the screening test is positive, then you may not need, like, other tests may not be necessary. And the screening test for dengue virus, it takes around 1 to 1.5 hours to check. For Chikungunya virus, it takes 1 day because like we run we call PCR test once a day. So the turnaround time is around like 24 hours. For Zika virus, we have to send the test, the sample out to other institution, and the result will be back in around 4 to 6 days.
Okay, and it's depend on the condition. If kind of like weak and cannot take good care of yourself, you have to be admitted and take care or stay here in the hospital under the care by.
So it depends on how you feel at that time.
Okay.
And normally for dengue virus infection, I would recommend, like, people would have fever. Normally, on average, people would have high fever and like a lot of symptoms, headache, muscle pain, for around 4 to 5 days. And that period, actually, in medical perspective, that period normally don't result in any severe complication. But the period after that, when the fever goes down, some complications like shock and bleeding could happen. So actually that period is more important to be observed in hospital if possible.
Yeah, I have visited many people, some of my friends who got dengue fever. The big complaint is like achy, the whole body, and he or she feel like just want to lay down on the bed and don't want to move, like my bone is everywhere is broken, kind of.
So that For dengue infection, there is a nickname for it, like breakbone fever. Some people call it that way because the pain could be so severe that you feel like your bones are breaking. That's why.
How many mosquitoes do we need to get that serious sick?
We only need one mosquito with the virus, and yes, so but it has to be with the virus, which is difficult to know if the mosquito that bites you have the virus or not until you show the symptoms.
Oh yes, I'm thinking about the size of the mosquitoes and the tank that it can carry the virus, and it's that strong. And that's why our old generation told us that the mosquito are more dangerous than the tiger. That's the reason, I think.
That's true, because like overall in each year, people die from infections resulted from mosquito bites, and they transmit the infection, which result in death more than like other animals could do.
Yes,
That's
yes,
why.
yes. Not so many chance to see the tiger, but the mosquito, yes. Okay, so and they are daytime mosquito, right?
The mosquito that transmit these group of viruses, they are called Aedes aegypti, and they biting mosquito, meaning mostly they bite during the day, in the morning, in late evening, but some also like bite a little bit more into like the night. So I would say it's more safe if you protect yourself from mosquito both day and night.
Some may fly home late.
Yes, that's true.
Okay.
And they like to stay near household, not in like jungle area. That's like different kind of mosquitoes. But these kind of mosquitoes, they like to stay close to our housing, our accommodation.
I have to say, including hotel.
Yes, that's
It's
true.
been hotel room as well. So that means if we are like on the beach, laying beside the swimming pool, maybe it's not that serious because it's sunny, right? But if they stay close to the house or to the hotel room, maybe under the shade, maybe more chance for a mosquito to stay there and waiting for them.
Yes, that's right. But anyway, it's based to protect yourself like 24/7.
But during the daytime, many people, they use sun protection to protect their skin. But if we have to protect ourselves from the mosquito too, how do we apply both sunscreen and mosquito like repelling? How should we do?
It's recommended to apply sunscreen first and wait, if possible, for around 20 minutes before you apply the mosquito repellent spray or cream.
Okay.
And also, like, because some chemical in mosquito repellent, it can lower the SPF that you use in your sunscreen. So it's best to use maximum SPF that you can find.
There are many options, variety of the mosquito repellent, and I see some as natural one, organic one with lemongrass, blah blah blah, and the other one is look very very like clinic stuff. Which one should we select or use?
I would recommend to use the ones that are approved to be strong mosquito repellents, like DEET, DEET. It's the name of a chemical, or Icaridin, ICARIDINA. These are the two chemicals that you can easily find in mosquito repellent products in Thailand, and they are proven to be effective mosquito repellents.
Okay, so now we know how to manage. And this is a type of prevention, but maybe we go more on detail about the condition, symptoms, and the treatment, the way that the hospital will take care of the patients of this group.
Can we go back to slide number 6?
This one?
One more. Yes, this one. As I said, like these group of viruses, they can give similar symptoms. As you can see, fever, red eyes, rash, joint pain, muscle pain, headache. Each of them has different typical presentation. For dengue fever, you usually have high fever, severe bone pain, muscle pain, and headache. for 3 to 5 days, and then the fever goes away. Some people followed by rash after the fever goes away. But for Zika virus, most people present with mild symptoms, starting with fever, mild fever, or no fever at all, with red eyes and rash. And for Chikungunya, most people present with high fever, just like 2-3 days at most, and with joint pain, with severe joint pains.
You say rash? Rash mean the whole body, or which part mostly that we have to focus?
Most of the time it happens all over, but the sequence, it may start at one places and then spread to another.
Okay.
So because not everyone presents with typical symptoms of these three, some symptoms could be overlapping. So it's difficult to tell who gets what. So most of the time we run some blood tests to check, to confirm the most dangerous one first. So most of the time we run the test for dengue virus first, because as I said, it's the one with the which could result in death. So if the test for dengue virus is negative and your symptoms are suggestive of either chikungunya or Zika virus, we run some more tests to check that.
And especially pregnancy women.
That's right.
Yeah. Your doctor who take care of you will also suggest for the test.
Yes.
Okay. I heard that someone who got chikungunya, or maybe I'm not right, after they have been treated and well enough to go back to continue everyday life, but they still have everywhere like joint pain for over a month. Is that true?
That's true. Chikungunya is rarely fatal, but it could result in some cases. It could result in severe joint pain. For some people, it could last for months, and in a very rare cases, it could last for like a few years afterwards.
Whoa. Oh, maybe
but
someone need to
as
check.
I said, that's
to
rare. Not
job.
everyone, not everyone has that complications.
Okay.
Go to slide ต่อไป. Okay. So for the important thing is for dengue virus, other than it being the most fatal, you could get repeated infection because there are 4 serotypes of dengue virus. Once you are infected with one serotype, you are protected against that serotype. But you can be reinfected if you get new mosquito bite with different serotypes. So overall, for dengue virus, if you are unlucky enough, you can be reinfected 4 times. But for Zika virus and for Chikungunya virus, from as far as we know, there is only one serotype in each. So once you get infected, in theory, you couldn't be reinfected again.
Well, I heard that after we got the first time dengue fevers, and after that we be able to get like vaccination.
Yes. Vaccination, you might have heard like during the past 4 or 5 years, there was an issue with dengue vaccine. People stopped using them because after they were launched into the market, some people who never got infected with the virus before, they got vaccinated, and later on, it turned out that group of patients get more severe dengue infection. So the recommendation right now for dengue vaccine is we give this vaccine only to people who has been confirmed to be previously infected with the virus. We can run a test for that before giving out the vaccine.
Okay. So recommendations, don't make decision by yourself. Better come and consult and check your data. If you're always coming back to this hospital, we have your record. Okay.
Okay. Next slide, please. As I said, most people, not everyone who are infected with the virus will show symptoms. So for dengue virus and Zika virus, most people don't even have symptoms at all. For dengue, it's okay. If you don't have symptoms, you won't have consequences. But for Zika virus, it's important in pregnant women. So even if you don't have any symptoms at all, you should still discuss to your obstetrician whether there is a chance that you get infected without knowing or not, because it could result in anomalies in your baby. Next slide, please. So why did I stress on like getting tested for pregnant women? Because Zika virus in pregnant women, it can result in anomalies that cannot be treated in the long run. It could result in microcephaly, which means small head size and small brain size. It could result in miscarriage, stillbirth, and other anomalies in babies as well. That's why it's so important to get tested, especially in pregnant women.
Yes, I think for pregnant women, every step, every week, every month, they should do something special by get the schedules and take it care by the hospital.
Next slide, please. So I'll explain a little bit more on how people get infected with the virus. The small, round, purplish thing you see is, I use that to represent the virus. People who are infected with the virus, once the mosquito bites that person and get infected with the virus itself, then it takes time to be multiplied in the body of the mosquitoes. You can see like I put like some more brown purple thing at the mosquito, and then that mosquito later bite another person who are not infected yet. The virus takes time to multiply in that person, and then that person expresses the symptoms of getting infected. But not everyone who are infected expresses the symptoms. As I said, like most people with Zika and dengue virus don't even show any symptoms. Next slide, please. Another difference of important difference of Zika virus from the other two is, other than getting bitten by mosquito, they can pass on the virus via sexual contact, and people who are pregnant can also transmit the virus through the placenta to that baby as well. So that's the difference of Zika virus from the other two. For Chikungunya and for dengue virus, it cannot be transmitted by sexual contact or to the baby.
Zika, very dangerous.
only in pregnant women. Okay, next slide, please. So how can you prevent yourself from these kind of viruses, these kind of infections? I would say don't get bitten.
Don't get bitten.
Don't get bitten by mosquitoes. And how to prevent that? You have to first, I would say use mosquito repellents whenever you can, both indoors and outdoors. And stay in, if you live in a house, make sure that it has mosquito screen completely closed. If you live in air-conditioned room, that'd be better, because the mosquitoes, they prefer not to stay in cold area, like air-conditioned room. And get rid of all standing waters that could be the breeding grounds for mosquito.
Especially in rainy season, there are many like bucket or plastic stuff that carry the water, and the mosquito can breathe in there, right?
That's right. So it's preferable to get rid of all standing waters around your house. Usually these mosquitoes, they don't fly that far. So at most would be like a few hundred meters. So if there are cases of any kind of viruses in your neighborhood, that means like the breeding ground is in that area. If you can clean it up, it will prevent further spread of
The same
infection.
mosquito can go and bite the other, right?
You mean other mosquitoes or other human?
The same one, for example, the one that bite me can also fly around and bite my friend, right?
Yes, that's right. The mosquitoes that bite humans are female mosquitoes. They live a little bit longer than male mosquito. Male mosquito only feed on nectar, on flower nectars, but female mosquito, they need human blood so that they have, how do I say it? Like they have enough energy and material to produce egg and and
Oh,
breed.
next section we will
And they
go in
live
detail.
and they can live for a few weeks, while male
Wow.
mosquitoes, they live only like maximum would be around 1 week.
Ah, I see. Okay. So try not to be bitten by the mosquitoes. Use mosquito repellents and stay in the area that quite far from wherever they are.
Okay. Next slide, please. So the viruses we talked about today, there is no specific treatment. There is only supportive treatment
By symptom?
for symptomatic treatment for all these viruses. So it's better not to get infected.
Wow.
And there is no vaccine yet for Chikungunya and Zika virus. There is a vaccine for dengue virus, but it has to be used with caution. So you should talk to your doctor before getting vaccinated.
Okay. So, and once, or for example, by experience, how long they have to be admitted in the hospital if they got like dengue fever, and next one is Zika virus or Zika and Chikungunya?
For dengue virus, well, it depends on how long they have fever. Most people cannot eat well, cannot drink well during the period that they have fever. But I would say the most critical period is after the fever is gone for 24 to 48 hours. After the fever is gone, at least 24 to 48 hours, if you show signs of recovery, after that you can be discharged. And signs of recovery are you feel like you want to eat, you regain your appetite, you have some rash, itchy rash, and your blood test shows increasing platelet and increasing white blood cells. If you have all these, you can be discharged safely.
So that means during the period that they are here admitted in the hospital, you have to continue the blood test to check the platelet, right?
Yes, that's right. We usually run serial blood tests every day for people with dengue infection to check.
So we have been talking about the mosquito-borne in viruses in Phuket, and our doctor told us about the prevention, how to prevent ourselves, and also the condition, symptom of the patients, and also the treatment a little bit. I'm sure that for every patient, maybe BAM standard is almost the same, but specific, like you said, also treat by the condition of each person. For those who are pregnant during this period of time, if you got bitten by a mosquito, please come into the hospital and have your blood test done. And I have seen the slide with the picture of Zika, which affects to the pregnancy woman is really, I have to say, we have to take best care of the pregnancy woman. Anything to say dealing these rainy seasons, and we have also a lot of children go to school right now, start going back to school. Any special suggestion for them to take care of themselves?
First, they have to prevent themselves from getting COVID-19.
COVID first.
So wear mask and wash your hands often. And for mosquito-borne infection, use mosquito repellent often.
And how often? How often? Well, like Sunbrook, someone said every half an hour or something like that. I don't know how busy we are, like sun protections and mosquito repellents.
For mosquito repellent sprays, how often you need to apply depends on the percentage of the active ingredients in the mosquito repellent spray. So like for DEET, 5% DEET can protect you only 1.5 hours, and then you have to reapply. But DEET at higher percentage, like for 20% DEET, it can protect you for around 4 hours before you have to reapply again. So it actually depends on what kind of mosquito repellent sprays that you're using. You can check the label, and it should be written on the back, like how often you have to reapply.
And maybe it's also depend on where we are, what kind of activity we are doing, right?
Yes, that's
if we are in the risky area, we have to follow the bottle. the suggestion on the bottle. Okay, so I think it's enough information, but if it's not enough yet, so please add or scan this QR code. You can be our friends on our expat link. And besides that, you also can communicate with us by send us the message and send us the questions, and we will consult our doctor and send you the answer. So thank you very much, Dr. Benjawan, today. Thank you so much. Very informative talk. And we will see you again next week on Thursday, 2 o'clock at our Health Dialogue by BDMS. Thank you and see you. Bye-bye. สวัสดีค่ะ